Yeah. Okay. So I forgot to record from the start, but just we covered basics. So we'll just move on. So we have to keep in mind doing any kind of research, we have to not forget the ethical obligations of that particular study design. Although in case reports, there are minimal ethical bindings, but still very important is patient consent. You have to take the patient's consent in written form with you. Even if the journal doesn't ask you and is not going to ask you, you should have it. And secondly, in some parts of the world, in some research centers, you need the body's approval also before publishing the case. So these are the main ethical obligations that you need to understand and have before starting the case. Then now we'll go through the steps one by one. The first thing is to identify the case, as we discussed before. The second step is to have patient consent and the treating physician's So sometimes you can yourself be a treating physician, or you can be a physician who was consulted, or you can be a medical student involved in the case care. So it's always good to have the treating physician's approval before you start the process. Then the third step is, of course, write the case report. And the final step is to publish it and share it. So about the consent form, from where to get, you can usually get consent forms from different medical journals. I usually use the BMJ, British Medical Journal's consent form. It is not necessary to use the same consent form from the journal that you're going to publish in. You can use any one of them. So this is how a generic consent form looks like. You fill in the patient details. Here the patient writes that I'm consenting to this case report. Then you have to write some specifics, email address and name and address of the patient. And sometimes they do call if you write the telephone number, and sometimes they do call and confirm if the consent was taken, the journal editors. And lastly, you have to write the name of the person, for example, you, who has taken this consent. So this is basically the content of a generic consent form. You can get this from BMJ's website. Now, this is another important slide. I would like, if any one of you is going to write a case report or thinking of writing a case report, then you have to go through CARE checklist. Not all the journals require your case report to be compliant to CARE checklist, but it is very good to follow this checklist while you're writing a case. It will help you to write a coherent case report. So this is how it looks like. I'm not going to go in details of this. You can easily just Google it, CARE checklist for case report, and go through it once you are, before actually writing the case. Now, with my limited experience and what I have seen through, because I'm reviewing for multiple journals also, there are some common issues that weaken a case report with respect to its quality. So let's go through them. What are those? So first of all, people tend to use fancy title with no direct link to the report. So this is sometimes not appropriate. Writing an abstract which does not truly represent the report. You just go too much into writing a fancy abstract, whereas you miss important things that it should have. So this is an important pitfall. Writing a case presentation and details of the patient in the introduction, which usually a lot of authors tend to do and which is not recommended by the editors and reviewers. Lastly, inconsistency in the verb tense, non-coherence, sentence structuring problems. These are also very common things that I have and other reviewers have seen when they are reviewing case reports from different authors. So you should, this will come with practice, but you should just keep in mind this is one of the reasons they get rejected. Lastly, if a patient has incomplete investigations, it is unlikely that you will succeed in reporting the case, because this will be raised either by the editors or reviewers. So if you are going to report a case, just make sure that the relevant investigations have been done. And missing to discuss important relevant studies from the literature. This is another reason which weakens your case report or even can get it rejected from the reviewers. Then focusing on facts and figures of the disease of interest in the discussion, hence making it an elaborated version of the background. So this is another common problem, that in the discussion, you are just elaborating more and more about the facts, which usually is a part of introduction. And we will look into it in the later slides, that how to write introduction and discussion. Then inconsistency in the conclusion with the rest of the report. In conclusion, you are concluding that something happens, whereas your whole manuscript was showing that that thing did not happen. So your conclusion has to be consistent with the whole report that you are giving. So now we will look at one by one the components of a case report. This is a very general component. It does vary from journal to journal, but usually 90% of the times, this is the pattern that you are going to follow. The first thing is title page. It includes the title, authors' names and details, which includes affiliations. And it's always better to put a word count there, word count of your abstract and your main manuscript. The next page is usually abstract and the keywords. Then it comes to introduction, or it is also called as background. Then case presentation, discussion, conclusion, declarations, references, and at the end, you put tables and figures if relevant. Now let's see about the title. So easy things to follow for the title. It should be simply self-explanatory, a clear understanding of the whole case report. I would always recommend to avoid use the terms first case or rare case or a unique case, because it's usually, if it is a first case, it's implemented. You don't need to use them. Also, do mention the study design in the title. This is important. For example, the case report or case report and literature review. This depends on the guidelines. I'm just going to mute the mics because too much noise. Okay. I'm not sure how I can mute. So please, if everybody can please just mute the mics. Okay, thank you very much. Okay, so let's just move on. And also, yeah, in the title of the case report, patient's demographics usually should not be there. For example, the age of the patient, gender of the patient, ethnicity of the patient. Usually you should not write them, but some journals do ask for it specifically. For example, one of the famous journals, American Journal of Case Reports, sometimes they ask for it actually. Let's see some examples of different titles. So this is a title which basically gives you an idea of the whole case report: refractory hyperammonemic encephalopathy in fibrolaminar hepatocellular carcinoma. So it gives you an idea that what this whole case is about, and then it tells you what the study design also. It is a case report and a literature review. On the other hand, so this is an American Journal of Case Report title. So it includes, they specifically asked to include the age, the origin of the patient. So it looks like this. It will include the whole 28-year-old man from India with this infection and pulmonary tuberculosis with central nervous system involvement. So this is another way of writing the title. Then again, this is another two examples of writing the title. So mainly title, basically, generally it has to represent the whole case, what it is about, rather than making it too fancy without showing what the case is actually about. Then we can go to the abstract. So abstract, it can be either structured or unstructured. It depends on the journal requirements. So whenever you are going to write a case or any study, first of all, the first thing you have to do after selecting the journal is to go to author guidelines and see what is their format which they want you to write in. So if a journal has not specified, it's always advisable to use a structured abstract. Structured abstract means that it is divided into background, case presentation, and conclusion. Then for the keywords, it is also important that you choose your keywords after thinking a lot, because it will help in increasing the audience of your work. People search your case in PubMed and different Google Scholar, different places using the keywords. So if your keywords are really relevant to the case, then it will help increase the audience, which ultimately actually increases your citations. So this is an example of an structured abstract, which is divided into background, a brief background, and case report, few lines about the whole case, and conclusion with the keywords. On the other hand, this is another abstract, which is unstructured, with just 3, 4, 5 lines in a coherent way without any headings. Then we move to the next point, which is introduction or background. So how to write a good introduction or background. So introduction or background is basically 1 to 2 paragraphs. It will basically form the basis of your report. It will justify why your report should be published. So it's basically divided into a few parts. First of all, you have to tell in the introduction what is known about the topic. You look into the literature, you find the facts about that topic. For example, if you're writing on COVID-19, you will write the facts that what is COVID-19 caused by SARS-CoV-2 infection, how many people is infected, how many people have been killed. So this is all information, which are hardcore facts, what is known on the topic. The next thing is, where is the knowledge gap? What is the rare thing that you are going to report? This you will briefly write in the case report. Lastly, how are you filling that gap? So you will tell that, for example, we are reporting that COVID-19 can cause fibrosis, lung fibrosis, which is not known. So then you will, in this second part, you will tell that this is a place which is unexplored. It can cause fibrosis. This is the way that it may cause fibrosis. And then lastly, you can tell that how you are filling that gap. We are reporting a case here with COVID-19 associated lung fibrosis. At the end, you should always write 1 to 2 lines on the aims and objectives of the report. This is how you can write a good introduction and background. Then the case presentation itself, it's very important to have it in a coherent and storytelling manner. It should not be haphazard, not just like you are writing progress notes of the patients, but it has to be very coherent. First of all, you start with demographic details of the patient, age, sex, gender, all that, comorbidities, these things. Then main complaints and all relevant history of presenting illness, physical examination details, diagnostic tests that were done for the patient. Then very important point, which I think most of the authors forget, and it can cause rejection of the case report, is differential diagnosis and the main diagnosis. So this is where the authors should take the reviewers through their thought process while they were managing the patient and trying to make the diagnosis, how they excluded the other common possible differential diagnosis and how they ended up diagnosing this rare condition which they are reporting. What treatment was given, what was the outcome, and if follow-up was done, then what was the follow-up, and what was the plan of the follow-up. If patient was lost to follow-up, you can even mention that. So this basically completes your whole case presentation. Then you write the discussion. So one of the most important components of the case report is the discussion. This is where most of the readers will be interested after reviewing your case report, because they are going to see what you are comparing your case with the previous literature. So it's going to be point of focus for the editors, reviewers, and eventually the readers. So ideally, it should start with expanding the information, but not duplicating, provided in the background. You will just briefly elaborate the basic hardcore facts, just in 1, 2, 3 lines to give a start. Then you have to present to the editor the reasons why this case should be published in a subtle way in the discussion. Subtle way, it means that you should not clearly and literally write why it should be published, but just show how rare the disease is, how clinically significant it is, what is its significance in real public health world, and how severe it is. So you have to show these things with relevant literature. Then this should be followed by literature review of previously published cases. So you have to go back into the literature search. We covered this in a previous lecture, how to do that. So you go to different databases and finalize the cases which are similar, and you discuss in the discussion. And it's always advisable to present in tables and figures if you have summary of the patients from the previous published reports. Then you can continue with comparison of your case with prior published cases. What were the differences? What were the similarities? And then you discuss in more details about the aspects of the disease which are relatively underexplored, discuss various theories proposed in the literature, and try to link them in a scientific way with your case. So whatever you are reporting, it should and it will have some basis somewhere in the literature. It will not be out of the blue. So you have to find pathogenesis of that disease or that rare process. Even in animal studies, you can find and then report in your discussion. So how to conclude? At the end, make it clear to the readers whether your case follows the same trends as those which were published before, or your case is different. It can be different. If your case is different, then what might be the reason behind that difference? You just don't report the difference. You show your own thought process, why you think that this is different than the previous reported cases. So the whole discussion again has to be coherent, not haphazard. And it should not appear as different pieces of information just taken together from various places and just incorporated randomly in discussion. So it has to be coherent. This will be a main focus of the readers to see if there is coherence or not. Finally, the last thing is in the whole case report is conclusion. So you do not, so this is one of the mistakes that a lot of young authors do, that in the conclusion they try to spice it up with information which is not true, or at least not known at that time. For example, if you are reporting first or second case of COVID-19 associated lung fibrosis, at that time, there is no much data. You cannot surely say that COVID-19 causes fibrosis. It just can be a mere coincidence. So in the conclusion, you cannot write that COVID-19 is now known to cause fibrosis. So this is inventing knowledge. What you can write is, we reported a case of COVID-19 associated fibrosis, which might be a pathology or association. So you can use words like might be, but don't use strong words. So conclusion has to be the summary and take-home message of the whole case and should not carry any presumed information, as we discussed just now. And there should not be new information in conclusion, but a summary of the report. So you have to use less objective words. For example, instead of COVID-19 is associated with stroke, you should write COVID-19 may be associated with stroke. For example, if you are writing COVID-19 associated stroke case report. So this is an example. So what words that you should use, which will lighten the mood of the editor and reviewers to tend to make your case publishable. More extensive studies are needed. Of course, if you are publishing a case which is rare, you need more studies, you need higher evidence. You can use the words possibly, this is the trend, it can lead to further research is required. So these things are important to write in conclusion to show the author that, to show the reviewer and the editors that you are not making any conclusions very solid because you are reporting a case which is not the highest thing in the hierarchy. Remember, we discussed the hierarchy before. Now, just to summarize quickly, there are a few points that I want to summarize actually. Okay. So first of all, take case report as a ladder to learn scientific writing, understanding literature review, conducting systematic search. Do not get stuck on case reports. This is very important. I have seen this practically. People start writing case reports and then they get addicted that, oh yes, this is an easy thing. You can just publish a case in 3 to 4 months, and then they just keep on writing case reports. At the end, they have 50, 60 publications and all of them are case reports. This is not good in your CV and it will be cached at some point. So after writing 3 to 4 case reports, always proceed to more advanced scientific writing, such as systematic reviews, original studies, and trials if you can get hands on that. Then try to make your case report as educational as possible. So the target should not be just to publish it. The target should be to make it educational for the readers. Once you make it educational for the readers, automatically it will be publishable content. Lastly, do not discuss anything without evidence to back it up from the literature. So whatever you discuss, there should be evidence in the literature to back your arguments. Strictly follow the journal guidelines for the structuring. This is very important. Otherwise, it will keep getting back to you from the editors or from the reviewers. So you have to follow the journal guidelines. Always look into the guidelines before starting the case report. Try to choose the most appropriate journal based on the case. Then try to use a journal which is widely indexed, as usually impact factor is not very relevant in case reports. Usually you will not find journals with impact factors which are publishing case reports. So what you can look as a good journal is to look how widely indexed it is, in which databases it is indexed. Then always try to present a literature review with your case report. If there are more than 10 reported cases, you can even do a systematic review with the case report. Now, how to do a systematic review with or without a case report, we will cover in one of the future lectures. Always take patient's consent and keep its record with you. Anytime anyone can ask you from the ethics committee or from the journal, it can be asked. If you are sharing patient's pictures, make sure you take adequate steps to make it unidentifiable, like putting black spots, black lines on the eyes. There are many ways to make it unidentifiable, so just make sure you follow that. Again, do not get stuck on writing case reports only. Take it as an opportunity only to learn scientific writing for larger projects. So you start writing case reports, but keep in mind, this is only for you to learn how to start writing for larger projects in future. Then try to involve people. Do not try to make it a one-man show. Do not, if you get a case that you are wanting to report, if you involve a few more people who are interested in writing, it will make it more publishable. If you write it alone, it may get published, but the quality will not be that good. However, of course, avoid ghost authorships. Although it's a sad reality, sometimes you can't avoid that, but usually try to avoid adding people who do not contribute in writing. Never be shy of sharing your published work among your peers. You are responsible to make your work visible. The more your case report will be visible, the more chances that it will be read, of course, and ultimately the more chances it will be used in the scientific studies, and you will get more citations. Some of the journals which I have used and I have found that they are good. They are PubMed indexed and reputable journals for case reports in medicine specifically. So I will just give an idea so that if you are writing a case, you can just look into these journals and see if they are appropriate for you. There is one journal, Clinical Case Reports from Wiley. There is a journal, European Journal of Case Reports in Internal Medicine. And there is American Journal of Case Reports. There is BMJ Case Reports. There is World Journal of Clinical Cases. Then there is SAGE Open Medical Case Report. So these are common and good reputable case report journals in medicine. The article processing charges are variable, and the waivers are also variable. Some they do waive the article processing charges, some they do not. So thank you. This will conclude my lecture. I think we just have 10 minutes now. The screen is showing me. So if you have any questions, you can unmute and ask me. And I'm sharing this Google form in the chat box, which is just a feedback. If you can please fill it and just let me know how the lecture was. Now it's open to any kind of questions you have regarding case reports. If you can, even you can type in the chat if you want.
डॉक्टर आयशा आप फैसिलिटेट कर सकती हैं, हमारे पास बहुत थोड़ा लिमिटेड टाइम है क्योंकि ये नॉन पेड वर्जन है हमारा। पार्टिसिपेंट से रिक्वेस्ट है कि अगर किसी का कोई क्वेश्चन है तो चैट बॉक्स में डाल दें प्लीज।
So there is a question, how can we get the recording? I think that the department will upload it maybe.
इसका हमारा फतीन YouTube लिंक है एक डिपार्टमेंट का, वो हम इनसे शेयर कर देंगे।
Okay, okay, I will send you
very soon. Yeah, वहाँ पे हम लोग अपलोड करते हैं आपकी रिकॉर्डिंग्स।
Okay, so there is one more question. Can we write a case report on a case unique to our hospital, but a case that sort of has already been reported? Yes, of course. So if a case is reported a couple of times, it can still be reported. Usually there is no cutoff, but if a case is reported like 15, 20 times, it still is a rare case and you can report, yes. And if a case is reported like multiple times in, for example, Western countries, never reported in Pakistan, still it can be reported because it's from a different geographical region.
And one example could be monkey virus is not that common over here, and if it is presented to any hospital anywhere in Pakistan, it can be a case report.
Exactly, yes. So does case report has any impact factor? So basically impact factor is for journals rather than the type of study. So there are a very few journals with impact factors who take case reports. Usually the journals who have high impact factors, they target larger studies like systematic reviews, original articles like that. Then there is a question, being a second year student, what kind of research will suit us? You can do any kind of research. I know people who are not even medical students yet, they are doing research, original studies, even trials. So you can start with case reports and there is no limit, only sky is the limit. So just start and get hands on any kind of research that you can. So we have to conclude the case at the end or not. So the conclusion has to be not only on the case, but the whole manuscript. So you have to have a conclusion. Yes, it is one of the necessary parts. So yes, my email address is here. I'm always available to any questions at any time. You can just email me. Just when you're emailing me, just introduce yourself so that I will know. So again, you can start from anywhere, I think, but it's easy for you to start with case reports because it's an easy process. It will give you a good practice to go towards higher studies.
Thank you so much, Dr. Fateen. This was such a nice and elaborative talk on case report series. So I think there are no more further questions, and we will make sure that the recording of this session will be available on the YouTube channel of the HPERD official YouTube channel. So thank you so much, Fateen, for your time, and see you very soon with the next session. And thank you, Dr. Samera, and all the participants for attending the session.
Most welcome. Thank you very much. Just again, I'm going to share the Google form. This is just a feedback so that I can improve the lectures in the future.
Sure. All the participants are requested to please click on the link and fill the feedback form. And we will arrange the next session of this series very soon. Take care, everyone. Allah Hafiz. Thank you again, Fateen, for your time. Thank you.
Most welcome. Thank you. Allah Hafiz all.
Thank you. Thank you so much. Thank you so much. Allah Hafiz.
Allah Hafiz.